Okay.
With diabetes on the rise and people's lives becoming busier and busier, traditional insulin therapy for diabetics becomes harder to fit into their lives. Studies show that the insulin pump therapy provides freedom and flexibility, eliminates the needs for traditional shot therapy, and better glucose control. This is the insulin pump, which I will describe in more detail later on. You can see it's no bigger than a pager, and it clips to a belt or into a pocket. The insulin pump provides freedom and flexibility by allowing the diabetic to come and go as they want, and allows for their lives to become easier by fitting into this schedule. When a patient is placed on insulin therapy, whether they are a child or an adult, it becomes a learning and trying experience. Traditional insulin shot therapy is time-consuming. Insulin shot therapy simply means that you administer via a syringe or insulin pen. Wolf 2006. These shots are taken multiple times a day and can be very painful. The insulin pump eliminates the needs for these shots. Once every couple days, the patient changes their infusion set and reservoir, eliminating the need for multiple daily injections. The flexibility and freedom offered to children with diabetes makes the insulin pump the best therapy for children. The best thing about pumping, most families will tell you, is the freedom. McCarthy 2007. The pump also offers better glucose control by allowing a constant drip of insulin to be delivered, an immediate dose of insulin before eating. With the insulin pump, it attaches directly to the body, and with the push of a button using the bolus wizard, that is the insulin the patient gets before a meal. Escape simply cancels out your selection so you don't get too much or too little insulin. Act button allows for the patient to give themselves their medication. Then the scroll arrows simply allow them to move up and down the screens without getting lost. The reservoir compartment is where the reservoir that holds the insulin goes, and the battery compartment is located on top, and it runs off a AAA battery. The freedom and flexibility provided by the insulin pump allows children and adults alike to come and go as they please, eat when they want, without having to have the same meals every day and eating on a scheduled time every day. Insulin pump therapy eliminates the need for traditional shot therapy, and traditional insulin shots are taken multiple times a day. If they're self-administered, you're usually into the belly, which can leave bruises and bumps, and it becomes very painful. They can also be administered into the arm with assistance from another person. Insulin shots become time-consuming and restrict the patients as to where they can go, when they can eat, and what time they take their medicines on a daily basis. Insulin pump therapy allows for better glucose control by providing a constant drip of insulin 24 hours a day, 7 days a week, and each drip is customized to that individual patient's needs based on their insulin to carbohydrate ratios, which is figured out by the patient and the certified diabetes educator. They also take, with the push of a button, a bolus dose, which is a dose that is taken right before meals. This helping to lower blood sugar during meals and after meals. This is all the reasons why that studies show that insulin pump therapy provides freedom and flexibility, eliminates the needs for traditional shot therapy, and provides better glucose control. Patients are offered freedom and flexibility to go wherever they want, whenever they want, eat when they want, and pretty much eat a varied menu every day. They do not have to poke themselves on a daily basis, eliminating scar tissue and pain during the day, and they're also given better glucose control by having the constant drip of insulin at all times. Are there any questions?
Yeah. Why would one choose an insulin pump over taking in a shot form?
A diabetic patient would choose insulin pump over traditional shot therapy because it provides the patient with ease of going wherever, whenever, and eating pretty much whenever they want and what they would like. Unlike traditional shot therapy, the patient must be on a scheduled eating and dosing pattern. They must also eat a very restricted diet and the same type of things more frequently.
How does the pump know how much insulin to give?
The pump is programmed to each individual's needs for insulin dosing. The insulin to carbohydrate ratios are determined by the patient recording what they eat, learning how to count carbohydrates, recording their blood sugar before they eat and 2 hours after they eat, and recording their insulin intake. The certified diabetes educator will then calculate ratios. This process takes about a month. When the insulin pump is received by the patient schedules an appointment with the certified diabetes educator, and they manually enter the ratios, and the pump delivers the insulin according to those ratios.
Where is the pump connected to on the body?
The pump user can connect the pump via an infusion set to their body in one of several locations: the abdomen, upper buttocks, upper thighs, back portion of their arms. Thank you.